Hi there, I'm Nurse Bailey, and I will be walking you through this educational training today. Our objective for this video is to demonstrate the nurse's critical role in tobacco cessation counseling for adolescents and adults, using the Centers for Disease Control and Prevention, or CDC's, best practices and evidence-based tools. So what do you say? Let's get started. Most people know that tobacco use is bad, but most patients might not understand the severity of the tobacco use problem. Here, I'm going to approach Mr. Martinez using the evidence-based 5 A's approach to encouraging tobacco cessation. The 5 A's consist of asking, advising, assessing, assisting, and arranging. Let's see how I do. Hi, Mr. Martinez. How are you doing? Any changes since your last visit? I know I asked you last time, but are you still smoking?
Yeah, I am. I know, it's terrible.
Yes, tobacco is terrible. Quitting smoking is the most important thing you can do for your health, Mr. Martinez. Every year, tobacco kills more Americans than do AIDS, homicide, vehicular accidents, suicide, drug use, and alcohol combined. Did you know that?
Sort of, I guess.
I know. I was the same way when I smoked. I sort of accepted the bad stuff, and I didn't think too hard about the huge number of people who actually die. But you know, smoking kills 1 out of 5 people every year in the United States. It's a pretty staggering statistic if you really sit down and think about it. I quit smoking when I started working as a nurse and saw all the health problems my patients were experiencing because of it.
Really? You were a smoker?
Oh yeah, it just became so hard to ignore all the people you can hurt. I couldn't stand to know that my smoking could have been the cause of my daughter's asthma, or the thing that could have made it worse. Or that she could even die from secondhand smoke, since at least 1 in 10 of smoking-related deaths are actually from secondhand smoke.
Seriously? Even secondhand smoke?
Yes. Secondhand smoke contains more than 70 chemicals that cause cancer. Seriously, secondhand smoke is considered the 3rd leading cause of preventable death after active smoking and alcohol use.
Oh, wow. That's terrible. I really don't want my children or wife to get cancer.
And it's not just lung cancer, Mr. Martinez. Smoking increases your risk for at least 14 cancers, including esophageal, pancreatic, uterine, cervical, and even acute myeloid leukemia.
But I don't smoke that much, so I doubt I can really get cancer.
Well, Mr. Martinez, it isn't just cancer, unfortunately. In fact, over 8.5 million people suffer from chronic conditions related to smoking, such as chronic bronchitis, emphysema, heart-related diseases, and reproductive problems such as erectile dysfunction.
Oh my. Maybe I should switch to spit tobacco then, or try those fancy e-cigarettes I keep hearing about.
Well, spit and smokeless tobacco can actually cause a lot of harm too. For example, they could lead to cancers of the mouth and even the pancreas. When it comes to e-cigarettes, there's no evidence that they are better alternatives to smoking or other tobacco. These products are not regulated in the U.S., so we really don't know too much about them yet. Some researchers found that they still damage the lungs. So, do you see why I want to help you try to quit? How about it? Do you think that's a possibility in the next 30 days?
I guess I never really thought about the actual list of problems related to tobacco. But quitting is so hard, and I feel like a failure when I try.
Yes, quitting tobacco is extremely hard. They say it can take 6 to 11 attempts to quit, and it's so true. I finally got it right about the 7th time I tried. What helps is to first acknowledge that tobacco dependence is a chronic condition that is hardly ever overcome in 1 attempt. Actually, you might try to quit for a few days and have an episode of relapse. That's completely normal. You have to think of it as a process. Fortunately, there are numerous effective treatments that can be used and repeated when you're attempting to quit, so you don't have to feel like you're all alone. So, Mr. Martinez, do you think we should set a quit date, say 2 weeks from now? Can I follow up then and see if you're prepared to quit?
Okay, sounds like a plan.
So, what we covered with this patient are some of the CDC best practices to address tobacco use and cessation. To ask is to systematically identify every tobacco user at every visit. To advise is to strongly urge tobacco users to quit with each visit. To assess is to then determine whether each tobacco user is willing to quit in the next 30 days. To assist is to aid the patient in his or her quit attempt. Finally, to arrange is to arrange a follow-up contact, either in person or on the phone. The rest of this video will show the various ways in which nurses can make a difference. As those serving at the front lines of healthcare, we can make a significant change. In fact, patients are more likely to quit tobacco with the help of their nurse. Although nurses have limited resources or time to address tobacco use, it is our job to raise patients' awareness. We also discussed some appalling statistics about the burden of tobacco use in the U.S. One of the most important things we as nurses must understand and relate to the patient is that tobacco dependence is a chronic condition that requires repeated interventions. Keep in mind, you might not always have this much time to talk to patients, but stress that tobacco use is a chronic, ongoing problem that can lead to negative health effects and that quitting takes practice. Patients must accept that they will have periods of relapse and remission, and so we as healthcare professionals must also accept the need for providing ongoing care, not just one time. Thankfully, there are so many effective treatments out there, so all we have to do is address the issue, give counseling, and communicate with the prescriber for medication if appropriate. As a result, our patients will be more satisfied. They simply need to be supported and reminded that quitting takes practice. Let's take a look at how I discuss some of the barriers we face with a fellow nurse. Mr. Martinez is here for his checkup. Don't forget to ask him about his tobacco use.
Last time he was here, he was not interested in quitting. I feel like I'm always prying when I ask if he still uses tobacco.
You're not prying. It's our job to educate and assist him.
I know, but I don't want to feel like I'm taking up his time by asking him the same questions over and over again.
Asking about it can be done in less than 3 minutes, even if he or she is a current smoker.
I guess so, but what if he says that he is ready to quit? What should I do then?
Nurse Rob brings up some good points about what some nurses face as barriers. So, how do we consistently and systematically ensure that we are doing our best to help our patients quit tobacco? The Ask, Advise, Refer model is an abridged version of the 5 A's that we just reviewed. It is also an evidence-based strategy to encourage smoking cessation. The first step in this model is to make sure to ask the patient at every visit whether he or she is ready and willing to quit. Let's see how Nurse Rob does with Mr. Martinez on his next visit.
Hi, Mr. Martinez. How do you feel today? Are you still smoking?
Yes, I'm afraid I am.
Is today the day you're going to try quit smoking? It'll have a huge positive impact on your health.
I know. Maybe I'm ready.
A patient might need more information or advice to make the commitment to start their tobacco cessation journey.
You know, quitting tobacco will help you breathe better and help you tackle that 5K you've been talking about.
You know what? You keep giving me good reasons to quit every time I see you. I think this time I am ready to try quitting.
If they are ready and willing to quit, one must be ready to refer them to an available resource.
Great. Well, let me tell you about a valuable resource called the Quit Line. It's helped a lot of people quit smoking.
Huh? What's that?
Well, it's a free phone-based or online service that comes with its own quit coach. It's available to you 24 hours a day, 7 days a week, and it can give you at least 2 weeks of free nicotine replacement therapy. Plus, if you are ever interested in resources specific to your community, they are more than willing to point you in the right direction.
Wow, that sounds really helpful.
With this patient, we use the Ask, Advise, Refer model, an abridged version of the 5 A's. Like the 5 A's, to ask is to systematically identify every tobacco user at every visit. To advise is to strongly urge tobacco users to quit with each visit. And finally, to refer is to connect the patients with tobacco cessation services, such as the Quit Line. Unfortunately, not everyone is willing to quit. In the following scenario, Nurse Sue is faced with a patient who is pregnant and not ready to quit. Notice how she uses another evidence-based strategy, the 5 R's, to help a patient that is completely unwilling to quit. The 5 R's are relevance, risks, roadblocks, rewards, and repetition.
So, Christine, you've been able to cut down because of your pregnancy. Yeah, I'm only smoking 1 or 2 cigarettes now, so I feel better about it. I'm so proud that you've been able to cut down in such a short period of time. I know how hard that is. And you were able to find a really good reason to cut down. But any smoking is still really harmful to your baby. Really? Even just 1 or 2 a day? Yeah, I'm afraid so. Smoking during pregnancy has been shown to cause complications, premature birth, low birth weight infants, stillbirth, and sudden infant death syndrome. If you didn't smoke, think of the benefits to your growing baby. Not to mention all the money you would save on cigarettes you can spend on things for the baby. But every time I try to quit, I have an urge to smoke a cigarette, especially with the stress of the baby coming. I know. That's why exercising is highly recommended when pregnant. It's a different way to relieve stress. Can you think of other roadblocks to quitting? Well, I'm gaining so much weight with the baby. I'm afraid if I quit smoking, I will gain even more. I just don't think I'm ready to completely quit right now. But think of your baby, Christine. The benefits of quitting far outweigh the reasons for not. You'll not only feel better after a while, your baby will be healthy. So please think about everything I said, including the negative effects on your baby if you don't quit. Exercise could be a way to relieve your stress as well as avoid extra weight gain from quitting. I am concerned for the well-being of you and your baby, so I'll make sure to follow up with you about quitting at your next appointment.
For those patients unwilling to quit, the 5 R's are more applicable and may move the patient to the next stage of readiness. Relevance encourages the patient to find a personal reason for quitting tobacco. Risk will help the patient identify negative effects of smoking. Roadblocks pertain to the barriers perceived by the patient, while rewards refer to the perceived benefits of quitting. And finally, repetition is about repeating the 5 R's at each visit until the patient is ready to quit. Keep in mind that everything that we've talked about may have to be modified depending on the target population. For example, nurses dealing with adolescents who smoke may face different risks and roadblocks, and so different information related to tobacco may be relevant for that population. Let's see how Nurse Amy discusses tobacco use with Ben, a teen who visits a nurse's office at school. She is also using a similar strategy to the 5 R's by prompting Ben to think of personally relevant reasons and benefits for quitting.
So, Ben, Why do you think you're having so many asthma attacks lately?
I don't know.
You can be honest with me. It's okay. Is there anything new going on with you?
Well, I guess since you asked, it could be because I started smoking a lot more.
Ah, okay. That must explain it then. And it seems like you know that.
Yeah, duh. I know smoking is bad for me, but I like it, so whatever.
Do your friends smoke?
Some of them, yeah. But my girlfriend hates it.
Aha! Why not quit for her then?
Yeah, I guess I should try. But maybe she should just try getting used to it.
Ben, is that fair though? Come on, you know you're also exposing her to secondhand smoke, which is probably another reason she doesn't like it, right?
Yeah, Nurse Amy. I totally know it's not good for me or her, but all my friends do it, you know?
What about your friends on the football team? I can't believe that they smoke too. With those long practices you guys have every day?
No, you're right. Coach doesn't tolerate smoking.
I know you were really hoping for a spot on the varsity team this year, Ben. With your girlfriend and football in mind, how about you give it a try? Just this week, no cigarettes. See how your girlfriend feels and whether your asthma attacks go down a bit. See if your performance out on the field improves without those cigarettes. See me in a week, and let's talk then. Deal?
You make a tough bargain, Nurse Amy. Deal.
For adolescents in particular, there are several tobacco cessation programs that can be recommended as a resource. Nurse Amy is pretty familiar with some of these programs because of her experience as a school nurse. Let's ask her about them. Nurse Amy, could you tell me a little more about tobacco cessation programs targeted towards adolescents?
Sure. One example of a smoking cessation program targeted towards adolescents is the NOT program, which stands for Not on Tobacco. Usually, adolescents participate in this program during school hours, in small groups, with topics including motivation, stress management, and the effects of smoking.
Fantastic! Thanks for the information, Amy. We should also be aware that our job doesn't end once the patient is referred to the quit line or other resources. Most individuals will relapse at some point in the quitting process. The following procedures can be incorporated as follow-up procedures and measures to prevent or minimize relapse. Provide congratulations and praise for any progress made towards quitting tobacco. Know what is out there. If other community resources are available, provide those to the patient as well. Always verbalize the benefits of quitting tobacco, using information that can be personally relevant to that individual. Finally, schedule a follow-up appointment because relapse and temptations will most likely occur. Lastly, let's consider the use of electronic health records to aid providers in referring patients to cessation services. This is important because the CDC recommends the use of a provider reminder system, such as chart stickers, vital sign stamps, or online prompts. As more hospitals and clinics adopt electronic health records, healthcare professionals can ask for an electronic tobacco cessation protocol. Through an electronic tobacco cessation protocol, or e-tobacco protocol, providers are prompted to ask patients about their tobacco use, initiating a tobacco cessation discussion. Not only is it easier and more convenient to refer patients this way, but your healthcare setting can also receive reimbursements through the Affordable Care Act. Don't let your institution miss out on the opportunity to improve patient outcomes while getting reimbursed appropriately. You can suggest this referral system at your next team meeting. Here's a quick resource for how to get started. Go to healthit.gov for implementing EHRs, and for the e-tobacco protocol, go to uttobacco.org/healthcare.html. The e-tobacco protocol is easy to use, whether you are a provider or clinical staff member. The e-tobacco protocol will take about 3 minutes to use, and it will assess whether a patient is either a current or former tobacco user, or whether they've never used tobacco in the past. The protocol will make it easy to assess patients' interest in cessation, and it will also encourage patients to quit. Not only will the e-tobacco protocol make assessment easy and efficient, but it will also quickly connect the patient to cessation counseling services such as the Quit Line. The e-tobacco protocol, along with an EHR system, can help save more lives while meeting meaningful use guidelines. Remember, as nurses, we have a critical role in tobacco cessation. With the evidence-based practices and skills provided in this video, nurses have the power to help adults and adolescents through their process of quitting tobacco. We must make sure to address tobacco use at every visit, urge our patients to quit, and refer them to cessation resources like the Quit Line. So how do y'all feel about the evidence-based practices and skills we've discussed?
You know, I feel much better about knowing what to do with my patients now. I can see why it's so important to address tobacco use at every visit. And I really like the part about referring patients to cessation services like the Quit Line, because the patient is able to have extra support throughout their attempts, making success more realistic.
Yeah, I agree. And even if patients aren't willing to quit, we know there are ways to talk to them and can at least get them thinking about it. No one is ever a lost cause.
Yep, it's always important to urge patients to quit.
And the earlier the better, like with my patient Ben.
That's right. We should be able to talk to adults and adolescents regardless of the different techniques or information that we use in doing so. And remember, quitting is a process, so ongoing education and support from the nurse is critical.